Coordinated entry is a mandated system required by the Department of Housing and Urban Development. The coordinated entry system in Metro Denver is called One Home. Coordinated entry is used to allocate most housing resources. These housing resources have specific eligibility criteria in which includes that the household is experiencing literal homelessness. The aim of coordinated entry is to ensure that people experiencing homelessness have equitable access to the housing resources that they need to resolve their housing crisis. Federally funded housing resources are required to use coordinated entry as their only referral source to connect clients to these housing resources. State and local funders may also require housing programs to use coordinated entry for a percentage of their referrals. There are many benefits to the coordinated entry system. Coordinated entry is a tool that provides equitable resource allocation. This system streamlines the process so that a household can only need to enroll in coordinated entry to potentially obtain housing for resources with eligibility criteria of experiences of homelessness. Coordinated entry also allows referrals that are based on need rather than ability. As previously mentioned, One Home is the coordinated entry system for the Metro Denver area. One Home covers the 7 metro counties, including Adams, Arapahoe, Boulder, Broomfield, Denver, Douglas, and Jefferson counties. Other areas of the state have their own coordinated entry system. In order to be eligible for coordinated entry, an individual or household must meet HUD's definition of literal homelessness. This includes any individual or family who lacks a fixed, regular, and adequate nighttime residence, meaning that they have a primary nighttime residence that is a public or private place not meant for human habitation, that they are living in a publicly or privately operated shelter designated to provide temporary living arrangements, including congregate shelters, transitional housing, and hotels and motels paid for by charitable organizations or by federal, state, and local government programs, or is exiting an institution where they have resided for 90 days or less and who resided in an emergency shelter or place not meant for human habitation immediately before entering that institution. There are 4 core elements of coordinated entry that highlight key components that are essential to connecting clients with housing resources in an equitable and efficient manner: access, assessment, prioritization, and referral. We're going to review each term to get a further look at the coordinated entry process. The first core element of coordinated entry is access. Decentralized service providers are accessible throughout the entire Metro Denver area at various access points to provide support to households experiencing a housing crisis. Service providers will gather information from clients and enroll them into One Home if they meet the criteria. At least one person at an access point must be trained to use the Homeless Management Information System, otherwise known as the HMIS database. However, this does not apply to victim service providers. Here you can view the access points map that provides the location of each access point. The next core element is assessment. Coordinated entry systems must have a comprehensive and standardized assessment tool. After a client is enrolled into One Home, the service provider will assess an individual's level of vulnerability at locations throughout the 7-county region. The assessment One Home formerly used was the VI-SPDAT. However, One Home is now using an updated assessment called the Coordinated Entry Assessment, effective January 2024. Although some providers and clients may continue to refer to the assessment tool as a VI-SPDAT, be mindful that they are referring to the Coordinated Entry Assessment. One Home created this new assessment tool to be more trauma-informed by removing questions that are not used in determining prioritization, eligibility, preferences, or needs, as well as the location in which questions are asked. The assessment is population specific and will differ amongst single adults and individuals, transition age youth ages 18 to 24, and families with minor children. The assessment tool gathers information on vulnerabilities, needs, preferences, assets, and housing barriers from the client profile, program enrollment, and standardized assessment tools. In addition to the initial assessment, there is a status update assessment that is used to document updates from the program enrollment data, and a current living situation assessment that keeps households active in the coordinated entry system. After assessment, the next core element of coordinated entry is prioritization. One Home coordinators will use the client data to equitably allocate resources. Because the population of vulnerable persons far exceeds the housing resources available, households are prioritized by vulnerability. Those individuals or households with the highest needs are prioritized first. Despite the functionality of coordinated entry, please understand that this is not a waiting list. Households are identified based on the number of anticipated housing placements. Please note that prioritization circumstances may change depending upon if those being added to the list are identified at a higher level of vulnerability. Prioritization also varies by population and is determined by the community. Although One Home does not use assessment scores for prioritization, a score is still generated upon completion but is not utilized for anything. For more information about the prioritization criteria, please click the link below. The last core component of coordinated entry is referral. This is when prioritized households are matched to housing opportunities in the community based on availability, client preferences, and program requirements. As housing providers are entering vacancies into HMIS, coordinated entry staff are identifying who's next in prioritization. One Home has updated prioritization over the last year to reflect the ever-changing needs of our community and continue to monitor each one for equitable outcomes and process improvement. Referrals are based on availability, eligibility, housing needs, and preferences. The One Home staff makes referrals on a weekly basis. Only one referral can be made per vacancy, and a household can only be referred to one housing program at a time. Housing resources allocated through the coordinated entry system include primary resources such as permanent supportive housing and rapid rehousing, but are not limited to additional resource types. Permanent supportive housing, or PSH, is offered as a lifetime voucher coupled with supportive services where the household pays 30% of their income towards rent. Permanent supportive housing can be project-based or scattered site. Project-based is when the voucher is tied to the unit in a particular building and cannot be transferred to another location. Project-based PSH usually provides on-site supportive services. If the household loses their housing, the voucher cannot be reissued. Scattered site, also known as tenant-based, is when the voucher is connected to the person and can be utilized at any apartment in which the unit available meets the rent, unit, and household size requirements and habitability. This voucher can generally be issued multiple times if the household decides to move, in addition to the units meeting fair market rent. Basic eligibility for permanent supportive housing includes having a documented disabling condition, a chronic illness, or income at or below 30% area median income. Please note that some permanent supportive housing does not require the HUD definition of chronic homelessness. For more information on the HUD definition of chronic homelessness, please click the link below. Aside from permanent supportive housing, another resource is rapid rehousing. Rapid rehousing is a time-limited financial assistance with case management. Assistance timeframes differ with each program and can range from a few months up to 2 years. Rapid rehousing resources can cover moving costs, security deposits, application fees, utility and/or rental assistance. Case managers will regularly assess income and household circumstances to determine how much the program pays towards rent versus the participant. Basic eligibility for rapid rehousing includes the client experiencing literal homelessness and having an income at or below the 30% area median income. Data is collected through the COHMIS or Colorado Homeless Management Information System. Elements of coordinated entry data collection in COHMIS will be covered in future subsequent training videos, including release of information, client profile, intake and enrollment into the One Home program, coordinated entry assessment, current living situation assessment, and status update assessments. This chart displays the workflow of the coordinated entry system and the process of a service provider enrolling a client into One Home. First, you check to see if the client is in HMIS. If the client is enrolled in HMIS, you'll need to check to see if the client has an ROI on file. If you've completed a thorough search in HMIS using the Social Security number, name, alias, date of birth, and or a unique identifier and are still unable to locate the client in the system, you can proceed with creating the client's profile. Be sure to collect an ROI for the client. Once the client profile is located, the service provider will complete the coordinated entry assessment to screen if the client is eligible for coordinated entry. If the client is not eligible for coordinated entry, please refer the client to other community resources. However, if the client is eligible for coordinated entry, there are additional steps to take throughout this process. The next step is to proceed to enroll the client into the One Home program. Once the enrollment is complete, a service provider will administer the coordinated entry assessment. After the assessment, the client is referred to the community queue. The community queue indicates a household has been assessed for coordinated entry and needs housing. A household must be on a community queue to be considered for housing. There will be multiple community queues visible in HMIS. Always place households on the One Home community queue. This is the queue that assessors access. Households are placed on a population-specific priority queue by a One Home specialist if the household is prioritized for housing. To make sure you successfully added the household into the community queue, navigate to the client profile. There should be a notification underneath the client photo and unique identifier that says Community Queue. Client has an active entry on the community queue. One Home community queue. Assessors use this. Finally, there is case management and follow-up. There are next steps that need to be taken after completing the coordinated entry assessment. These steps are just as important as enrolling the client into One Home. First and foremost, the service provider needs to collect vital documentation. This only includes a birth certificate, driver's license, state ID, and a social security card. These documents can be housed in HMIS. We will review that process later in the training. Proof of disability and homeless verifications would not be considered vital documentation because they are time specific. For example, proof of disability or a homeless verification may have a requirement to be collected within the last 60 days. Therefore, it is not helpful to obtain these documents ahead of time. Vital documentation collection is important because when a client is prioritized for housing and documentation is needed, we want to make sure the client has everything required to successfully receive housing resources. The next step is to stay in contact and record data in HMIS at a minimum of once per month. You should update contact information regularly. This is an expectation of One Home. Contact information is vital for connecting a household to housing after they have been prioritized. We want to make sure that we can easily contact a client if they receive housing. In the case that a client has been granted housing and cannot be contacted, it is a possibility that the client will be exited from the program and will be required to complete the enrollment process over. There are several ways to record client activity in HMIS, including the Providing Services tab and Current Living and Status Update assessments. This will be reviewed later in the training. Another reason to maintain contact with the client is because a household or individual will become inactive after 120 days without HMIS activity and will be removed from the community queue and exited from One Home. When this happens, the client will need to be re-enrolled in One Home in the event they reach out again for support. Lastly, you should continue to look for housing resources for the client. One home is not a guaranteed housing outcome for every household assessed. Households should continue pursuing housing resources outside of one home after the assessment is completed. This includes senior housing, subsidized housing for people with disabilities, LIHTC, low-income housing tax credit housing options, and other affordable housing options. Included on the screen are some specific examples of these. We want to ensure that we're able to reach as many people as possible and provide them with the necessary resources. This chart compares population-specific data of those surveyed through One Home versus those housed through One Home in 2022. The purpose of this slide is to show that although One Home is a great tool to allocate housing resources, it is not the only tool. If we take a look at the adult individuals, out of 2,795 adult individuals who were surveyed, only 298 were housed through One Home. Even though housing 298 adults is impressive, there's only an 11% housing rate. There is not a guarantee that those who take part in the coordinated entry system will receive housing resources. This is why it's important to continue to search for housing resources for clients after completing the coordinated entry assessment. Let's take a look at a few privacy reminders. Any HMIS or One Home documentation should be locked inside a cabinet behind a locked door. This includes physical copies of ROIs and other documents containing sensitive data. If for any reason you have to transport physical documents, please do so in a locked document bag and never leave it unattended. You are holding sensitive client data, and we want to do our duty in protecting their personal information. When disposing paper documents, the paper needs to be securely shredded once it has been uploaded and entered into HMIS. Lastly, personal identifiable information should only be sent electronically to the One Home team when the email is securely encrypted. Once again, we have a duty to protect client information.